Hello guys, welcome to my channel Fetal Insights. My name is Future Rupande Nichinama, a Zimbabwean trained nurse midwife, privileged to be a pioneer fetal medicine midwife in Zim Fetal Medicine. Currently, I'm based in the UK where I'm practicing as a registered nurse. I've got almost 2 decades of practicing as a nurse midwife, and I am super proud of being a pioneer fetal medicine midwife. Before I take you through to what Fetal Insight has brought you, I'm surprised where I am now and where I came from. I took a strong decision self-willingly in upper 6th second term to say, I think I am born to be a nurse, deriving from a point of the community view, what I had encountered in that community, or what I had encountered in also part of my life, to think nursing is what I've been called for. I learned in rural areas of Zimbabwe, in Biriri High School, a mission school, in upper 6th. It was a sister school of my previous academics, Rusito High. So I chose Biriri in terms of my faith, and also I wanted this combination to become an advocate. How it all switched my career path to be a nurse then. However, I'm super happy that there's also advocacy in nursing. This community I've learned for my upper 6th was a community which had been affected by Cyclone Elin 2000. They were so devastated. They were suffering mental breakdown. I would like to tell you guys, they had lost opportunities. They had lost their loved ones. They had lost their properties. They had lost their plantations, poor harvesting, and they were just in a mental breakdown. I thought to myself, these people need counseling, they need support. I was inner driven to say, I think I need to help people to regain their normal state or their activities of daily living. Fortunately, I was enrolled at Harare Central Hospital as a nurse. The journey began. It was so exciting. 3 years of total deliverance or change. Knowing conditions, managing conditions, and seeing prognosis, how people get deviated to normal, to unwellness, back to wellness, how the nurses intervene, and the important role of the nurses for people to regain their health. I qualified, got deployed at a provincial hospital. I'm super happy with that experience because I know how provincial hospitals feed to referral centers and how they also receive from the districts and the grassroots. This referring protocol also helps in the fetal medicine, as I would start to interact you guys with the Fetal Insight in as much as modern practice are concerned. I transferred to a referral center back to Harare again. Now I'm at Parenyatwa, and I trained as a midwife later on. Also got enrolled in fetal medicine as a pioneer fetal medicine midwife. Let me introduce Fetal Insight to you guys. This is a channel I would share my own life experience and my work experience as a fetal medicine midwife to raise awareness or to give knowledge about best modern practices in managing pregnancy, and just to let every woman knowledgeable about the fetus. Every pregnant woman should be knowledgeable about the fetus. That's about your pregnancy. I would always advocate for the unborn baby. I would always advocate for the best modern care or use of technologies to manage pregnancy. I would also want to share with you the importance of male involvement in as much as pregnancy is concerned. That's inclusion of our partners, our husbands, in as much as management of pregnancy is concerned, and the importance of significant others, as well as I know fetal health. I might talk about fetal health or fetal care, but we should also know that women's health can affect the fetal health, and definitely would also talk about those issues. So Fetal Insights also help healthcare providers to offer best management to fetuses. That's early detection of complications, early management of complications, or early identification of potential problems, and offer the necessary care to prevent those problems or complications. If we have prevented complications, it means we have better birth outcomes, or we have improved birth outcomes. It also works as an advantage to our own demographic data that we no longer have unknown causes of stillbirths, unknown causes of premature births, or unknown causes of neonatal deaths. This is just an advantage to the nation as a whole. So fetal medicine is the use of modern practice to manage pregnancy, or it's the use of technology to manage pregnancy. I would explain the serious scans which happens in fetal medicine so as to have better birth outcomes. As I said before that, I'll share my experience as a mom, as an adult in the community, the social stigma, especially to women, in as much as unfortunate birth outcomes are concerned, the myths and the misconception, the traditional or cultural or religious beliefs in as much as pregnancy is concerned, versus my own experience in fetal medicine. Fetal medicine is an answer, guys, to most of the misery we have in our communities. Most of the things we have no answers to in as much as birth outcomes or pregnancies are concerned. Also, as I mentioned before, male involvement is so crucial in fetal medicine. We need men to get involved in psychological support, emotional and financial support, bonding with the baby, in critical decisions making, and encouraging some behavioral changes in pregnancy. It's just that feeling, to be loved once you're pregnant. We really encourage male involvement and the importance of significant others. Fetal Insight would like to encourage women or the women of childbearing age and their partners to invest in your pregnancies. Don't fail to go for your review dates, or to adhere to follow-ups, or to what midwives would have recommended, or to what the fetal medicine specialist would have advised, or the health education would have been given by the midwives for just goodies. I would like to encourage to divert some of the monies for the benefit of the fetus, to just have a better pregnancy outcome or an improved birth delivery. Let's just invest in our pregnancies. Let's divert some of the monies for the best outcome of our pregnancy. And Fetal Insight would also want to encourage planned pregnancies. In as much as you can, ladies, let's have some planned pregnancies. This means improved pregnancy management, also early detection or prevention of some of the complications we encounter during pregnancy and during delivery. I think this is the right time, guys, to welcome fetal medicine in this arena whereby there is based in modern practice in pregnancy management, and there is comprehensive care in managing pregnancy. There are one, high resolution ultrasound scans and imaging. Two, there are investigations, maternal and fetal investigations, which can be done in fetal medicine. Three, there are surgical procedures and interventions which can happen in fetal medicine. Four, there is multidisciplinary approach whereby some other departments are involved in managing your fetus. Five, maternal and fetal health are both managed in fetal medicine. Six, there are now reasons to the unknown causes of stillbirths, neonatal deaths, and premature deliveries. Seven, this is the best care every woman or any woman can get to manage pregnancy. Definitely, there are improved neonatal outcomes and reduced mortality rates with fetal medicine practice. Additional value to fetal medicine practice. I remember I was a trainer of trainees, and we managed to train all provinces in Zimbabwe on the skills in fetal medicine ultrasound scan, how they feed in to the provincials or refer to the fetal medicine specialist. So I would like to encourage pregnant women to visit antenatal clinics and get the best care. If your station or the antenatal clinic doesn't have fetal medicine midwives who are scanning, please get referred to the nearest clinics. And if there are some complications, do not hesitate to be referred to the next point of care. Take note, we managed to train doctors and midwives and also some sonographers in private sector and also in government sector and in almost all the provinces of Zimbabwe. Meaning to say we are not really covered. There is a gap in as much as access is concerned, but we now have a minute group of people who can offer this service. Please take advantage of the group. So I'd like to motivate someone to say, don't regret. There's no room for regret in your life. Now you're talking to somebody who was an art student, who wanted to be an advocate, and who is also a victim of Cyclone Elene. Not only the people in the community where I was living suffered, but I was also a victim of Cyclone Elene. I traveled post-day Cyclone Elene. There were no roads. Fishmongers would help me cross the rivers. I would walk long distances without transport, and I would also have another fishmonger to cross the river with me. I don't know where I got that courage. I don't know where I got that bravery, guys. I'm surprised I'm here and I wasn't taken by floods. I don't know where I got that resilience from. And thank God to Biriri High School staff. Kept me for about a week at that school, giving me support and also counseling and just to avoid this mental breakdown from the suffering I had undergone. Many thanks to Biriri High School management. When I was a nurse, now I'm enrolled, I qualified. When I said I came back to Harare, worked at Parenga to a group of hospitals. I appreciate the rotations whereby you'd work in general wards and worked in cardiothoracics, in neurology and many more other departments, as well as picking shifts in ITU or in intensive care unit, coronary care unit. And I was also dialyzing. Do you know I can dialyze patients? That was a great experience I've encountered in my life. And it also made sense to me when I was now a fetal medicine midwife, because some of the conditions I was managing, I didn't know their origins. I didn't know how it really looks like. But now I could visualize on the ultrasound scan, this heart is on the wrong position. These kidneys are abnormally big. Okay, this is dilated, or this is normal. Able to differentiate the normal from the abnormal and how to manage. Many thanks to Dr. Verenga, my trainer, or also giving me the exposure to practice in fetal medicine, government sector and private sector. Thank you very much. So all events in your lifetime work out together for the good. Now I'm here as a nurse midwife, and I'm super proud of myself. For more information in regard to fetal insights, fetal medicine, stay tuned, guys. More is coming. You can learn a lot about pregnancies, management, prevention of complications, the ultrasound scans, the visits, how you should book, and why you should be knowledgeable about what you are carrying. In this era, 21st century, let every pregnant woman be knowledgeable, know in and out about the fetus you are carrying. So share, subscribe, like, and comment. Thank you.